Thanks for tuning in today. I'm Dr. Nick, the Incrementalist. Join me as I seek out the small incremental changes being applied in other industries that we can learn from and that can be applied in healthcare. Can these changes bring immediate value, but also add up to the big improvements and revolution we need in healthcare? Come along with me to explore the possibilities. My innovative guests from around the globe have used small incremental improvements to achieve their moonshot.
And today I am joined, as I am each month, by Dr. Craig Joseph. He is the Chief Medical Officer for Nordic Consulting Partners. And this week, this month, special month, it's a political month. We are right around the corner from the election, Craig. And you're an American. I'm clearly not. I'm wondering, what do you think is going to happen?
Wait, you're not an American?
Well, I am, but people obviously think I'm not because I have this funny accent, right?
Well, you talk funny, but you still are an American, I believe. So you will be.
Yes, I am. I'm a voting American too.
You have voted or will soon vote.
I have.
Yeah,
the easy option.
Yeah, so why don't you tell us? Certainly, don't tell us who you voted for, but you can
good Lord, no.
Tell us. You can predict who's going to win, because when people think about healthcare, all they really want is political fortune telling.
Yeah, so I have to say, I've probably not watched, certainly in the time that I've lived here, I haven't watched the elections as closely as I have this year. And I've watched them in the past when I was able to vote. When I first arrived, I wasn't allowed to vote. And even when I had a green card, I still wasn't allowed to vote. And quite frankly, my interest in the election kerfuffle was very limited, because if I had no influence to it, what was the point in following it? So it all came a little bit of a shock. It was something of a tsunami, fire hose of information, and a shock to turn on the TV and realize all this stuff was going on. Oh, and by the way, it's going on all the time. It's not just every 4 years. It's like, does it ever stop? And this year, of course, even more significant with COVID-19, healthcare, lack of access to healthcare, challenges. So where do I think it's going? I as best as I can read the tea leaves, and I don't have any better insight than anybody else, but I'm going to stick my stake in the ground and say, I think Biden is going to win this election. I struggle a little bit. I didn't grow up with this electoral college, but I think he has to win the electoral college. It doesn't so matter if he wins the popular vote. I think that's right. Is that true?
That is right. And you got that question correct on your test, I'm sure.
Yeah, if it was one of the 5 or 10 I had to answer out of the total 100 that we had studied for hours in the car from the CD, I'm just telling you. And I think Congress is a given. That will be Democrat. It's going to stay the same. The big question in my mind is whether the Senate flips. And that's a little bit more of a toss-up, but there certainly seems to be signals that suggest it might, which would make for a very interesting circumstance if that happened. But as this episode or show is running, the results may or may not be available. Do you think the results will be available at the end of the election night or even the following day?
No. Actually, that's what we should be predicting, is when will the results be finalized, and when will most Americans accept them? No, I don't think they'll be done. The only way, and again, my expertise extends to watching news shows, so take that for what it's worth. I hope
that's not your source of medical information as well.
That is my source of medical information. That and old episodes of ER featuring George Clooney. That's the other source of healthcare information that I have, and it's a little out of date.
If I can find a suitable image, I'm going to put you up on the screen as.
A lot of people confuse me, Dr. Nick, with George Clooney, and I'm just going to leave it at that, because this is an audio medium. And so let's just leave it at that. I had to mute
myself to stop the laughter from overwhelming the soundtrack.
True story, actually, when I'm going to meet people and we're sending each other, this is back in the before times when we met people, I would send them a picture, we send pictures of ourselves so that we know who the person is that we're meeting. And I would often, if it was appropriate, send a picture of George Clooney from ER and say, he's a pediatrician, I'm a pediatrician, we all look very similar. Under any circumstance, getting back to your question, I think no one's going to know that night because we're going to have so many mail-in ballots and absentee ballots, and many states will, by law, can't even start looking at those until election day, right? And
only in some states, though, I think.
Okay, I said many. We can go with several.
Okay, I'm sorry, I missed several, but yeah, so it's not all of them.
No, certainly not, but enough of them, and especially I think in the Midwest, some of the key states that we're looking for may not have results of 50 or 60% of their ballots may not be counted
because so much of it is mail-in.
They're absentee, which is generally mail-in, yeah, and they can't be counted in the same time frame as or as easily or as quickly as the votes that are cast on election day. Now, again, I don't understand what's involved and how much paperwork and how you count those things and how they have to go through, but that's what people are saying. That's what I've heard. So unless it's a blowout whereby one candidate just wins so much of so many states, then it won't matter what those other ones are right. saying. But, you think about it, and most people never voted absentee or mail-in, I should say. The numbers are crazy this year. Right. Now, there are states where it's all mail-in, and it's been mail-in for years.
So let me ask you this. So, I mean, in your era, so I've only been voting for a relatively short period of time. When you first started voting, it must have been a manual system. It wasn't digital, right? Was it automated, or did they have to manually?
No, I've always actually voted on paper, and I've been in I think I've voted in 3 different states, and I am proud to say that I was in Florida where we had hanging chads. And this might be before your time. It's certainly before.
No, I do remember.
Yeah, you remember hanging
Chad Lorry carrying the votes.
They had these things in Florida called butterfly ballots, and poked out little holes. And if you didn't, I guess, which no one knew beforehand, or at least I didn't, but if you didn't do a good job of poking through that little piece of paper, you had a little chad hanging there, and sometimes the machine would count that as a vote, and sometimes it wouldn't. And yeah. But after I left Florida, then it's always been paper, right? It's like you fill in the dots with a pen or a pencil, and then they scan those and run them through machines.
But they were scanned, so it was still digital. So the results still happened within 24 hours for the most part.
Oh well,
Not in that election, I remember, but that was a whole different issue, right?
Yeah, besides that Florida one, yeah, and they can count them very quickly, and again, when the minority of votes are coming in that way, or you're allowed to coming in via mail, or you're allowed to count them ahead of time, then you can get results that are pretty accurate pretty fast. But I think we know that a lot of the states that are really going to make or break this election are not allowed by law to count early, and that will mean that unless there's a blowout, which I don't think very many people are predicting that would happen, that we're not going to know for days. There you go. That's my prediction.
Okay,
we won't know the answer for days.
I need to pull out my heart medicine and be ready to take it, because I was hoping to sort of relieve some of the stress and just know an answer at this point.
I consider myself kind of a political junkie. I mean, it's not. I can cure myself of this, but I have no expectation that I'm going to go to bed Tuesday night knowing who's won. None.
Well,
absolutely none.
I go to bed before any of this stuff because I can't be bothered to wait. I'll wait till the morning. I sleep soundly.
Just watch Netflix. That's my recommendation for Tuesday.
Good suggestion. So watching Netflix. And speaking of lookalikes, I just want to say, you may think you're George Clooney, but I do get Gordon Ramsay a lot.
Yeah, I'd give you that.
And this one was a surprise to me, but when I went and looked, Robert Redford.
No.
Oh, come on.
No. I'll give you Gordon Ramsay. Well, because he talks funny and he's also very difficult to work with, just like you. So Gordon Ramsay, sure. Robert Redford, no, not so much.
All right. Well, so now that we've covered politics,
are we done? I think we've hit all the healthcare things.
That would come up in this show, but I think it was inevitably important because it relates to healthcare and there's all sorts of things tied up with it.
Sure.
Let's talk about the trial and specifically the volunteer that was in the trial that I think we saw who sadly died.
Well, now you're talking about a COVID vaccine trial.
Right, vaccine trial, thank you.
Not a criminal trial.
Yes.
Yeah. So you're referring to, I think it was in Brazil. Brazil, yeah. And so as we know, many organizations are trying to put together a vaccine for COVID-19. Thank you very much. And they do trials to see if these vaccines are, number one, effective. Will they actually prevent or mitigate the disease? And two, are they safe? Because, again, this is something you're giving to perfectly healthy people, right? That's part of the idea of a vaccine, very different than a therapy for someone who's already got the disease. And so there were a bunch of news stories about a physician who got the who was enrolled in the vaccine trial, had gotten a number of shots, and then developed, no one was really sure at the time, but ultimately died during that vaccine trial of COVID-19. Yeah. And that made a lot of headlines. But very quickly, we learned that he was indeed enrolled in the vaccine trial, yet he got the placebo. And so what that, again, just to kind of take us back to to level set, certain people, about half of the folks generally who are in a vaccine trial, when they get a shot, there's just normal saline, just liquid in that shot. And the physician or nurse who's giving them the shot doesn't know what they're getting, and the patient doesn't know what they're getting. Actually, no one knows what they're getting because it's randomized. And so if someone does have a reaction, a certain number of people who have access to that information have to go and kind of break open this envelope and say, okay, what did you get? And so this person got placebo. And so they contracted vaccine and then died of vaccine. Again, unusual for someone who was young and healthy, but certainly we know it happens. And there seemed to be a lack of communicating that information to the general public, right? So there were people who were like, well, that's why I'm never going to get a vaccine, because this guy enrolled in the vaccine trial and then he died. And it was disappointing to see some of the headlines that didn't point out in the headline, once the information was known, that he was in the vaccine trial, but he never actually got an experimental vaccine. He actually was in the placebo arm, and he got the disease and he died. And that's got nothing to do with safety or the efficacy of the vaccine itself. And so it is really, I think the moral of the story is, A, you have to have all the information, and then B, you have to communicate that information effectively. And I could get, if that story came out very quickly and no one really knew what he got, did he get the placebo, the salt water shot, or did he get the actual vaccine? But once we knew that, a lot of newspapers were still saying, not being clear and seemingly being accused of, appropriately or not, of just seeking clicks.
So for those of you just joining, I'm Dr. Nick, the Incrementalist, and today, as I am each month, I'm talking to Dr. Craig Joseph, pediatrician and chief medical officer with Nordic Consulting Partners. We were just talking about the sad death of the physician in Brazil who died. He was part of the vaccine trial, but as Craig rightly pointed out, he was on the placebo arm, which at the time nobody who was in the trial knew. Certainly he didn't. The people treating him, that information was made available, and needless to say, headline grabbing, gosh, somebody in the vaccine trial died. Therefore, immediately let's jump to incorrect conclusions. Vaccine causes death. Vaccine doesn't prevent death. All of those things. And in fact, it was none of the above. And none of that really got corrected, which for these two physicians and scientists and followers of science is pretty frustrating. So we put the record straight there, which I think is entirely appropriate.
Yeah, I would also just point out, it's completely reasonable that he might have gotten the vaccine and had a reaction and died. And so that's not to minimize the fact that it could have happened, right? I think we all acknowledge that. That's why we do these trials, and it's research, and we think it's safe, but we're not 100% sure it's safe. And even, again, nothing is, when I had patients, sometimes I had parents who would say, can you promise me 100% nothing will happen with X? And my answer was always no. I could never promise you 100%.
Right.
Sometimes bad things happen and they can't be predicted. And sometimes they happen at such small numbers. But so again, it's not that we're saying it's impossible that it would happen. It's simply that in this case, we actually knew pretty quickly that it wasn't related to the vaccine, because the vaccine wasn't actually a vaccine at all.
Also, to your point, is that it could even have been he had the vaccine and it didn't work, which is also the purpose of the trial, which, would have been equally sad. But, one of the things that we're looking to find out before we start making massive numbers of doses and subjecting people to a vaccine, we want to make sure that it's safe and it works. So,
right.
Absolutely. Essential points, and that's why we do trials and we don't rush things out. We follow the science, not politics.
Absolutely, and assuming that this vaccine works like others, sometimes no one will actually ever tell you it will decrease your chance of getting the disease. Often we say it decreases if you do get the disease. It'll make it much less likely that you'll die of the disease, right? Which is not as good as not getting it, but much better than nothing. And so oftentimes that's how I would counsel patients about the flu shot. This is a completely separate thing, but with the flu shot, oftentimes people still get the flu, but it's a much less severe case. And the chance that they're going to end up in the hospital or intubated is much less if you've gotten the flu shot and then gotten the flu anyway. So again, keeping all of that in mind, it's as you say, it's good to follow science and follow the steps and not you can certainly hurry up the steps, but you have to follow the steps.
Right. Okay. So moving on, I think the other thing that's happening next week, in addition to the election, or at least the voting, let's not say the election results, because it sounds, based on your prediction, it's going to be a while after, is the information blocking, which we've talked about before, but apparently any delays or anything that was supposedly in the works is not happening. We're going to see that enacted next week.
That's still the plan. And if you would have asked me if I was going to bet that there would have been a last-ditch delay, I would have said, yeah, I think there will be due to the COVID pandemic and because the government often delays things that they say they're going to do. But so far, none of those have come out. And so again, to refresh everyone's memory, the information blocking rule came out from the government earlier this year and said that physicians and hospital systems have to share certain discrete electronic health record information with their patients and in a format that makes it accessible. And again, the idea being ultimately we're moving towards, or want to move towards, the way you can search for an airline ticket. So you might be interested in going from place A to place B. You could go to the Delta website and the United website and the American website, or you could go to one of the multiple websites that have access to all of those pieces of information. And then
Expedia, for example.
And Travelocity, those kinds of places, right. Exactly. And they will put that information together for you so that you can kind of compare apples to apples and do other things with it. And so the idea is that, hey, I could send my healthcare information to these third parties and they can perform a service for me. Of course, there's a little danger because there's a difference between your personal health information and the travel information that websites like those give you. But be that as it may, it looks like that's moving forward, and the first baby step will be occurring November 2nd, as of our recording now. So you'll be able to get, again, basic information, not everything, but basic information that's been outlined. Like progress notes from your doctor and your vital signs and those kinds of things. And the hospital or healthcare system or doctor's office will have to send that information via standard interfaces that these third-party software vendors can get access to and kind of pull that information out. So it will be exciting. I think it's going to, again, be step one. I suspect a lot of people won't be ready, even though they're required to be ready on November 2nd. And those that aren't will quickly try to become so.
What are the consequences? So if I'm not ready and somebody asks for it, are there punitive consequences?
So as of now, generally, if you're a provider, there are no monetary consequences. However, the government has said that they can label you as an information blocker. And so I see you laughing. I hear you laughing. So there are financial consequences if you're a software developer. And there may be financial consequences if you're a source of healthcare information that's not. There can be financial consequences for you. But as of now, if you're a provider, if you're a hospital or a doctor, probably no financial consequences. That's coming. There's no question that's coming. And the I think their threat to label you on certain websites is also is real. To a lot of people. You don't want to be looked up on Medicare or Medicaid or other websites that the government maintains and say, here's a list of 3 hospitals. Oh, by the way, hospital number 3 on this list doesn't share like your personal information with you. Like that is not going to help attract patients.
So it reminds me a lot of the wall of shame for the cybersecurity. It's, some way that you didn't want to appear. And were required to, you had to declare it and you showed up. So very similar. So whilst not monetary, it certainly, I think, will start to have some impact. So it'll be interesting to watch and see if that holds true for the period of time between when we record this and when it actually goes public. We'll see.
Yeah.
Could be some last-ditch attempt, right?
I would have expected that it was going to be delayed, and I think the government gave some hints that it was going to be delayed. But so far, we're still on. It's going to happen. I don't think there's any question that it's going to happen. It's a question of when and what will be the circumstances and what will be the impacts for folks who aren't able to or don't comply with the rules.
So we've only got a short period of time left. So just brief words about the second, third wave. Who knows what it is, but it seems like COVID-19 is exploding and there's some significant challenges with various parts of the US. In fact, around the world, I know Ireland has gone to level 5 lockdown. UK is on all sorts of lockdown and quarantine and whatever. What's going on?
Yeah, well, I think what's going on is what a lot of folks predicted was going to happen in the winter with the flu, but it's now happening in October. And so we're seeing either a second or a third wave, depending on how you look at the graph. But we have hospitals here in the United States who are already talking about potentially not being able to care for everyone that walks in their door and to have to make decisions about who's going to get an ICU bed. So that's very scary. No one's done that yet, but there are folks talking about it. And I think we're now at the point where the good news is PPE and ventilators are not as restricted as they were. Certainly we have lots of ventilators. PPE is still a problem, but not nearly the problem that it was. Now we're at the point where the problem is the doctors and nurses. It's not the beds. It's not the space. It's the people to take care of those, of the patients in those beds. And if you don't have enough of them or if they're sick, it's a problem. And as we recall at the very beginning, when New York was really the epicenter, nurses and doctors from other parts of the country came to New York and other places to help. Well, now we have 2/3, 3/4 of the states that are, red on the map. And so it's going to be much more difficult, if not impossible, to get people to come and help because they're busy where they work.
Yeah, and I actually saw some data that suggested that not only is the disproportionate effect of COVID-19 on, certain communities, but that includes healthcare frontline staff, including nurses who are falling and suffering COVID-19 and the consequences of the disease, which is going to compound that. So my final appeal in the closing seconds would be to follow the suit of the New Jersey governor, who issued whatever his governor edicts were that said we'll allow foreign medical graduates to help and support out, because I know I'm only one person, but I know there's a lot of people like me who are qualified clinicians, and we may not be the best resources, but we're certainly more skilled, and we could actually come and help out if we were allowed to. I've been precluded from doing testing. I was doing testing locally, and they changed the rules, and now it has to be a current licensed whatever. So there are some solutions. There are people out here willing.
I concur.
All right. As usual, we've run out of time. We'll see if I was right and Craig was smart to say, I don't know, or I'm not going to give you a projection.
I projected there will be no answer on Tuesday night. That was my projection.
That's true. But it might be by the end of the week of the run of the show. So just remains for me to thank you, as always. Great pleasure. Craig, thanks for joining me on the show.
Pleasure. Thank you for having me.
Thanks for joining me today. Do you have any better ideas, or have you found a small incremental change that's brought about a big improvement in your world? Let's continue the conversation on our hashtag, The Incrementalist, or share with me at DrNick1 on Twitter. You can find more information about the show on our program page at healthcarenowradio.com, and tune in next time to hear my discussions with leaders and innovators from around the globe who've revolutionized their space by using small incremental improvements to achieve their moonshot. I'm Dr. Nick, the Incrementalist, and I'm starting a revolution through evolution.